Are there hematocrit differences between cisgender men and transgender men who are on testosterone replacement? This is an interesting question, and it's one that one of my clients asked me the other day. Not sure what led to the dialogue, but this patient asked me about this. And I want to address it because we already know that people on testosterone replacement, from what I've seen, if I had to guesstimate, probably about 10% ish of our clients will have an elevated hematocrit, and it does vary in terms of the degree of hematocrit elevation from what kind of administration that they're using for their TRT, whether it's a transdermal or whether it's an intramuscular injection. Now, I'm not going to go into the various nuances of hematocrit elevations in terms of secondary causes, such as like sleep apnea or hydration status. There's too many nuances, and that's far beyond the scope of this video. Besides, I've already covered that in a handful of other videos. So let's talk. Are there hematocrit differences from cisgender men versus transgender men? In short, yes, there will be differences. Now, both parties will have a propensity towards having some expression or some degree of hematocrit elevations. However, cisgender men will most likely have hematocrit elevations that are markedly higher than those of the transgender men. And this essentially boils down to biology. The cisgender men have a natural greater propensity and more robust response in terms of EPO production, secondary to being on testosterone replacement therapy. Erythropoietin is a hormone produced from the kidneys, and it tells the bone marrow to make red blood cells. Now, one of the biggest stimulators of EPO production is testosterone. On top of that, cisgender men, biologically, we have a greater capacity to produce more EPO. Hence why when we get on testosterone replacement, if we're going to have increased productions in red blood cell mass and we're going to have higher hematocrit levels, it's going to be because biologically we have a greater propensity towards that EPO response. But what I found super interesting is that both parties, whether transgender on TRT or cisgender on TRT, both parties tend to have a similar response to a certain form of testosterone in terms of how much it raises their hematocrit. So whether they're a transgender or cisgender, if they're on the transdermal, I tend to see less degree of hematocrit elevations as compared to the injectables, which whether they're transgender or cisgender, if they're on the injectables, hematocrit elevation occurrences tend to occur more frequently, and the degree of how high the hematocrit goes is also shared between both parties. But the big stark contrast between both parties is that cisgender men tend to have higher levels of hematocrit if it were to occur. And again, this can go back to the notion, the understanding biology that we produce more EPO and we have a greater EPO response to testosterone. And lastly, it appears that both parties tend to level off in terms of how high their hematocrit gets at roughly about a year-ish. And that's what I tend to see quite frequently, unless there's some other secondary condition like chronic kidney disease or the patient smokes, which if you smoke, you probably need to focus on quitting that and not getting on TRT in the first place. Or say if they have a secondary condition like sleep apnea. The big difference, and this has been shown in the literature as well, is that most transgender patients, when they get on TRT, they level off roughly about a year-ish, and their level off, their ceiling usually falls around 50, 52-ish. And what I see in like the cisgender men is, for the most part, most guys tend to hit their ceiling around 54, 55 in terms of their hematocrit. Thanks for watching, and to the patient that asked this question, it was a good one, great topic. I appreciate it.